Good afternoon, Dr. Shailesh.
Good afternoon.
Thank you so much for being part of our first industry-focused series on the trend and outlook of healthcare industry. We are really, really honored to have you with us.
Thank you.
And we would love to hear more from you on your journey so far. So we have Dr. Shailesh Jhawar with us, who is a promoter and director with Apex Hospitals. Apex Hospitals is a chain of multi-speciality hospitals in Rajasthan, which has grown from 2 hospitals in 2019 to 7 hospitals now in that region. Mr. Jhawar has been engaged in the hospital. He's a second generation promoter, so your father started it.
Yes.
And you've been taking the baton now. So, Mr. Shailesh Jhawar spearheaded the Hope Digital ICU initiative.
Yes.
And heads the unique tele ICU platform at Apex Hospital. So we will hear more from you on that initiative. When did it start? How did it start? And how is it progressing?
So I think thank you very much for inviting me to this session. We are a very focused, I would say, network of hospitals. I think over the years we've grown from, as you said, from 2 hospitals which were in Jaipur to about 7 hospitals in Rajasthan. There are 7 or 8 medical programs that we do very well, I think so, and some by design, some by default. We have done a lot of work to enable our healthcare ecosystem in those medical programs across the network very well, basically. It's a family business to start with, so there are some core values which the family brings to it. But with the growth, there is a conscious effort to professionalize the business. So we've redefined our kind of the values this year also. So we have gone from certain values which we had to shed to certain values which we have to kind of acquire. So I think like agility, accountability, empathy and ethics were always core to the family, family of doctors. So, agility, accountability, because now if the network has to go, the bandwidth has to go across the network, and even at the speed that we have to grow. I think so. Those are the 4 or 5 things I'm very excited about in this journey in the future.
Excellent. It is really impressive to see how you've grown and how you're wanting to relook at, or at least reflect back and make whatever changes you need to make for the next phase of the growth journey. So congratulations for all the growth so far, and I hope that continues in the coming years as well. So my first question, Dr. Shailesh, is I think the hospital that was started by your father and now you're handling, you started with tier 2, tier 3 cities, and that's where your focus is.
Yes.
What's been your sort of experience of building a sustainable hospital chain business in tier 2, tier 3 cities, and what are 2 or 3 key sort of learnings of setting up a hospital business in tier 2, tier 3 cities?
So I think a few things that are very, very important is in tier 2, tier 3, we realize there is a volume value mismatch. Okay. So volume is there, but how do we discover the healthcare value?
Yes.
Because we have, as doctors, we know what values are. Okay. And for us, medical outcomes are by far the drivers of our value system. For Apex, I would say so. So what we decided was, if we had to thrive in this tier 2 business, there has to be some USP that we have to generate. Okay. And choosing the locations of these places, we understood Rajasthan very well. So we understood 17, 18 districts of Rajasthan very well, because we were there for 15, 20 years, the family had worked on the ground a lot in terms
Yeah.
of, moving around people. So the back-end knowledge of that 17, 18, 20 districts, basically. So we came up with a few things. Certain population size you have to have. So if you have to do super specialty,
So footfall and the mass is important.
footfall and
right?
mass is very, very important.
Yeah.
And there is a critical number which we think works for us.
Yeah.
And there is some science behind that also. Basically, if you look at the population, if you do a little bit of market research, if you do the disease profiling of it,
Yeah.
though everything is very regional and very dynamic, and Rajasthan is a big landmass state, basically, as we look at it. But a population of about 20 lakhs or 225 lakhs is very, very important for
Right.
to set up a super specialty.
Yeah.
Second thing is, initially, you have to focus on two things. One is the infrastructure alignment with the medical program has to be very, very patient-centric.
Yeah.
In tier 2, tier 3, frills, I think in terms of modernity,
Yeah.
has to go into where patient outcome can be improved or patient efficiency or operational efficiency can be improved rather than the more of a look and feel as compared to if you
Yeah.
want to put it that way. Third thing is
So the delivery needs to be more efficient.
delivery needs to be more efficient. Okay, so and I think you have to make smart choices
Correct.
of where your focus is going to be
Correct.
when you are actually delivering healthcare on the ground, basically.
Correct.
And the third point is doctor retention.
Yeah.
And doctor engagement is
Very
something
critical. Yeah.
that we were lucky. First is the mindset of doctors. We understand mindset of doctors. We understand the healthcare ecosystem.
Yeah.
And third is we are practicing doctors ourselves.
Right.
So to kind of bridge the gap with bit of design, bit of default,
Yeah.
we thought that a very focused approach for doctor engagement and doctor retention is very, very important.
Correct.
And a perpetual skilling of these doctors.
Correct.
Community, every hospital is actually the first port of call is the community that it serves.
Correct.
Okay? And the community starts trusting that hospital if you are delivering emergency services with transparency, patients are able to trust you, and the retention in terms of medical emergencies, critical care. There's one data point that I want to discuss, and it was highlighted in COVID, I think so. By some reason or the other, 41% of people still struggle in the back of an ambulance in India's population.
Right.
If 67% of our population is still kind of in a urban, semi-urban, a rural, semi-rural area, all of these people have to come to a tier 1 city.
Correct.
We did a very small calculation that if you look at about everybody has to travel 250 kilometers,
Yeah.
41% of people might succumb because of one reason or other.
Yeah.
The contribution to GDP, if these people survive and if they are of an age where they can contribute to economy,
Correct.
is immense.
It's a lost opportunity.
It's a lost opportunity.
Yeah.
So those are the 5 things I think which were the thought process behind this the scaling up of in tier 2, tier 3.
Absolutely right. So I think one is the awareness of healthcare and the other is access. So
Yes.
access is very important. If they have to travel 250 kilometers to get access, I think it is it can be quite traumatic for one of your patients. So in terms of tier 2, tier 3 cities, you still think there is a lot more opportunity to further expand, grow, and it's not about consolidation. It's more about what is the your sort of outlook for further growth in tier 2, tier 3 cities. Obviously, you've grown phenomenally over the last 5-7 years. How do you see the growth, or you think consolidation will happen in the coming years?
So again, I think tier 2 market is different, tier 3 is different.
Yeah.
But the opportunity is immense.
Right.
We've just said 67% of population with. So, tier 2, tier 3, I think we're still unlayering the potential still. We've
Yeah.
peeled the layer,
Just
as
the
you said,
tip of the-
accessibility.
Correct.
I would say the way India is growing, if you look at from all the economic indexes,
Yeah.
people want, rather than affordable, people now want effective and transparent healthcare.
Correct.
Okay. I think the affordability thing we have to somehow overcome, crossed a little bit because insurance penetration has increased,
Government support.
technology, government support, infrastructure, road development, economic development.
Yes.
Some of those things are catching up
Yeah.
now with the affordability thing.
The trust quotient has to go up.
The trust quotient has to go up. I think COVID was a big leveler.
Yeah.
And I think, from the support of the community and healthcare community as a whole, I think we have been able to revitalize to that to some extent.
Yeah.
Quite a decent extent, I would say so. If you look at India as a whole, there will be around 700 to 800 districts,
Yeah.
which in a tier 2 or tier 3 town, which could need a 100 bed, 200 bed
Hospital
facility.
Yeah.
Now, there are two things which are very, very unique in tier 2, tier 3. One is this, this is from my experience, and I don't have a lot of data to back this right now. But the cut, copy, paste approach from a modular hospital will not work in terms of the medical program because need is different. You have to actually find out the unmet need of that market, micro market.
Yeah.
Second is there must be some regional or local players there. What I feel is rather than, should not use the word cannibalize, but rather than cannibalizing on what they're good, how can you become complementary to that or collaborative?
Collaborate. Yeah. I agree.
And secondly, I think is that you have to have a very modular approach because, as I said, if you have volume, if you have government support, and if you modularize your approach, I'd say if you design the hospital infrastructure in such a way that you can later expand the beds, bring in infrastructure, somewhat certain infrastructure later, add additional capacity.
Yeah.
So your fixed cost to start with is amortized,
starts getting
gradually.
normalized. Yeah.
Yes.
Very interesting. So, you've got what I understand is still 40-50% of your patient that come in are from either Ayushman Bharat scheme or some of the state schemes. So managing working capital is going to be very important, right?
Yes.
How have you been able to do that, both from a working capital perspective and your ability to look at your cost drivers
Yes.
to make the business sustainable? Because on one hand, your cost of acquiring customer has gone down significantly because of access to Ayushman Bharat, etc. But operating model, working capital, how have you been able to sort of take care of that over the last few years?
If you look at it, and as I said, the most important thing is from the numerical point of view, I'm talking right now.
Yes.
I think if you're talking about
numbers
right now. So cash flow is key,
very important
to this business, and I think if you have to have professionals to manage the cash flow. Okay, you have to. I think that is not for the day-to-day people or somebody like me who's into healthcare operations or understands medical very well.
Correct.
You have to understand that this is a very serious thing.
Yes.
You have to leave it to the professionals. That is one thing I think that is something that I've learned over the years. That is itself is a huge task.
It's a requirement. It's not a okay.
Secondly, if you have to manage cost, actually, who are your delivery people on the ground?
Correct.
It's doctor and nurses.
Yes.
Okay. Sometimes I feel that we rely too much on technology or other things but the delivery on the ground is done by the people who actually are away from the reality of it. Okay, they're taught in a certain way. They're very skilled people, but with the skill and knowledge, there is a delivery gap on ground reality. I think it's very important to make them understand what is the ground reality, how we have to continuously engage with them, show them the data, make certain processes, make them part of that ecosystem where delivery. So let's say we have a cardiology pathway.
Yeah.
Now everybody has to be aligned for that cardiology pathway, for that patient to have a 2.2 day ALOS. We have a very low ALOS and post angioplasty ALOS.
Right.
So if said benchmark is 2.5, we have across the network have 2.2 days, sometimes as do 2 days.
Right.
Now how to do that efficiently for all the patients with patient safety, with good outcomes, until unless you make the ground people aware, partner with them. So I think that is something very, very important. Thirdly, you have to continuously identify as we grow. As success has layers, efficiency also has layers. So when you discover one layer of success, you have to also let go of another layer of inefficiency, I would say so. So until and unless all these things are going hand in hand, and the ground people are knowing. What I found was, as a doctor, a lot of times people at the ground did not know about these things.
Transparency is also key.
Transparency, data flows, discussing in a language that they can understand.
Yeah.
A doctor should not be expected to understand the P&L completely.
Yes.
But a doctor or a nurse or a person who is a leader in healthcare should be able to decipher his decision making, which correlates with the P&L of this organization. So that is how I think cash flow is serious. It has to be given the ownership or accountability to somebody who understands this.
Yeah.
You have to bring operational transparency with data, make people, as I said, accountable and partner to that.
Yeah.
That is very, very. Third is there is a continuous, cost in terms of efficiency is a constant endeavor.
Correct.
You can never say that there is nothing that is possible. I have hit the ceiling.
Yeah.
We have to
keep looking for the areas where you can be more efficient.
Yes.
And agile. Yeah.
Yeah.
But I think I really like the point that you made on the partnering with the doctors and the people on the ground, because unless you do that, and unless you do it transparently, you will always have an issue with, how do you collaborate and make them integrate with your overall vision.
Yes.
So that's an excellent point. Okay, so my next question, Dr. Shailesh, is you had access to private capital 6 years back. That's when you first decided to take external capital.
Yes.
What was the reason for, one, why did you want to take capital? Two, what value did some of this external help bring in beyond just capital in your growth journey over the last 6 years?
There has been a constant endeavor to, the reason of I've spent a lot of time in abroad, get trained, and I think it was an opportunity to come back, and I was kind of following a tradition or a legacy or footsteps of. So there is always a desire to kind of grow.
Yeah.
I think in 2017, one of our mentors, so I still remember, said, now, because he saw healthcare, I think like you have a very different lens of healthcare, I have a different lens. He saw healthcare as a very different lens.
Yeah.
So he asked us a question, do you want to become a chain or you want to become a part of a chain?
Right.
And the desire was always that we felt that as doctors we could give more. We have something that we can build on. So we said we want to become a chain. We thought there is a lot of firepower in terms of ideas, in terms of execution, in terms of passion, in terms of unmet need. We understood that very well, that what we can bring to the table. But there is always passion actually does not do everything in business.
Correct.
Okay. Because there is numbers, there is money.
Yes.
There is some certain level incompetence with, I would say, as an entrepreneur that you have.
Yes.
So you always need partners, whether it's capital.
Yeah.
So we thought if we can partner on this becoming a network journey,
Yeah.
it will make us this entire journey more. The chances of success are
Yeah.
higher,
Correct.
basically. So that was the initial thought process. And because tier 2 market, uh, there is a certain risk appetite.
Yeah.
We were venturing into something new. As I said, cash flow. We identified cash flow was going to be a problem if we are going to do that. So I think some certain circumventing of those things were only possible with external money, not with normal routine financing purposes.
Yeah. And I know you've not, while the amount of raise that you did was reasonably decent at that point in time, but again, it was not, uh, I would not say it was a very large sum.
Yeah.
And it's been 6 years since then till now, you've not raised any further capital. You've been able to grow the business to where it is today, from 200 beds to 900 beds. I think you had 2 hospitals, today you have 7. Your revenues were around 50, 60 crores. Today you are at close to 300 crore. Uh, do you think someone like Soma said, they were able to bring in some more value in your growth journey, which helped you come this far beyond just access to capital?
Yeah, I think the role of Somerset as a partner cannot be. We have to, definitely
Yeah.
we kind of value their partnership. But now, I've traveled this journey in the last 6 years as a, there are 4 things which I always think about. 4 C's.
Yes.
I always think about this, which kind of differentiate also, and I think now become clearer. The haze is gone because we've traveled this journey so far.
Yes.
Attracting capital or getting a strategy right and getting capital is so challenging, but I think conscious capital allocation after that is very important, especially with the healthcare. I think
Yes.
Because we were not a startup, we were a profitable business at that time, brick and mortar, very frugal in mindset, I would say. So we come from a Marwadi Banya family.
Yeah.
So I think allocation to capital consciously in terms of a lot of data that we did not know, how to look at data, how to allocate capital.
Yes.
Those kind of decisions, I think it's very important. I think you have to grow profitably in a mature business.
Right.
Second is, I think, collaboration. You live in your own healthcare ecosystem, you can manage. Sometimes we don't look outside the box enough.
Yeah.
Okay. So making sure that we looked outside the box. So we did a lot of new things. Tele-ICU. We did the Dhadkan program, which is an AI-enabled tele-ECG monitoring program.
Yeah.
Which are a very unique business model in itself, and gave us a lot of momentum to going forward. Normally, medical professions and hospitals are very good at compliance, medical compliance, so NABH accreditations we already had. But bringing business compliance as a part of your DNA, that have to be done not only in terms of taxation and filing, but a lot of other compliance, I think.
ESG.
So ESG, reporting, data, looking at data, so that your DNA, your mindset shifts from looking at data from a balance sheet point of view, from looking at data from this is how business is done point of view.
Correct.
And then I think every entrepreneur will reach to a certain level of, I would say, maybe you can say even incompetence if you have to scale a business, or a ceiling. So capability enhancement, attracting talent from outside. So I think those 4 C's are very important, which external capital can bring you.
Partner like Somerset. Yeah. Interesting. Do you want to just share a bit more light on, you made a point on the tele ICU, and I think that's been a unique initiative
Yes.
that you are spearheading at Apex.
Yes.
You want to talk about how did it start and your journey with that initiative so far?
Yeah. So I trained in UK.
Yeah.
I'm intensivist by training. And when I came back to India in 2013, uh, we were growing. ICUs, number of ICU beds were growing every
Yeah.
year, if you couldn't see in Apex. And I think we were doing well in certain areas. But still, in my own skin, I was not very comfortable with the certain things. So my father, in his own wisdom, gave me an idea that, rather than discussing this and opening this file, you have to collaborate with people.
Yeah.
You have to make them part of this thing, that how you think of healthcare or ICU. I had some Western ideas, and so we said we'll start looking at data together. So it was health. How hopes came around is health outcomes prevention evaluation systems. Basically.
Right.
So we wanted to. There was a 37-point data that we used to get from every ICU in the month. We used to sit, we used to look at it, and then people started liking this. So some small changes we started making, and the bundle was getting very, very strong.
Yeah.
And then we started implemented in other hospital. People started to collaborating. Outcomes started to improve. So there was green shoots of transformation that people were seeing, and I was also getting very bold.
Yeah.
I think 2019, Somerset liked this idea.
Right.
We partnered with GE, and I
Right.
think that was for me there was a big learning curve. They believed this in us.
Turning point for you.
Digitalize the entire ICU. We're still, I think, one of the I would say front runners or the first movers to. And then unfortunately, COVID came.
Yeah.
Luckily, we had already set up this system in two of our hospitals. One hospital was very new, so we could check that system early.
Right.
And a lot of our partner hospitals, which used to normally collaborate with us or send patients to us for higher super specialty, unfortunately, they had no surgical work or no medical work, only patients with COVID.
Yeah.
We were quickly able to roll out this idea to them. So I think because we had the ability, had demonstrated the ability in terms of outcome improvement, basically, and we were able to roll out very, very quickly.
Yeah.
So now we run different models.
Right.
We're still refining this model. It's a very
Evolving.
space, I would say. So in terms of technology also, AI is coming and bringing its own efficiencies and challenges.
Yeah.
Regional play is very, very different still, I think. So access to healthcare.
Right.
So we are in 2-3 places in Punjab.
Right.
We're trying to look at UP. We are in certain places in Rajasthan.
Yes.
Yes, so I'm very excited about the possibilities that we can do in the
opportunity
future.
that
Opportunity
brings.
Yes.
Right. So next question, Shailesh, Dr. Shailesh, is more around your strategy for the next 3 to 5 years, broadly in terms of since you've only raised capital once in the last 6-7 years now, what's your outlook on the future? Would you want to further grow as per your sort of vision?
Yeah.
And continue to sort of seek sort of a capital from partners like the private equity funds, etc. Any thoughts? And also, do you have any strategy for M&A
Yes.
in the coming years?
So yes, definitely. I think capital is something that you grow from one growth journey to another growth journey.
Correct.
Capital and partners are required. So we're definitely looking into that direction, basically. And obviously, we are, as I said, from not only numerically, but I think the vision has also got refined, and maybe I think we are continuously changing that in terms of how we deliver on the ground, basically,
Right.
not in the vision. So we are still very tier 2, tier 3 focused.
Yeah.
We want to change efforts, few things, I think. So, hence healthcare is very dynamic. So we've started doing robotics some places. We've entered
Internal
into
processes.
internal processes,
Right.
because it helps us making medical USPs. I
Yeah.
think you have to continuously grow because we still look at healthcare as every hospital. It's in a different stage of growth.
Right.
Some are more mature. Some have developed medical USPs. Some are still in that journey.
Yes.
But the newer hospitals, we still want to be in tier 2 location. Again, 25, 30 lakh population, maybe a bit more drainage. We want to, again, be 100, 200 beds.
Right.
Scale them gradually in a modular approach, basically.
Yeah.
Asset light. The focus mostly in 6 and 7 therapeutic areas, basically.
Yeah.
The DNA will still remain the same. That I think start with critical care, emergency, win the trust, build the community, then get super specialty layering. And I think there are some things which I think you have to understand from a dynamic point of view. The requirement for oncology, specialized oncology also.
Which is a very different space.
Which is a very different space. At some stage, how will that kick in into this? Because it's a slightly capex intensive.
Correct. Radiation machines.
And compliance point of view also and infrastructure point of view.
Yeah.
So we have a certain toolkit for the future, basically, and it's the way I think we've been successful till now. It's been very modular. It's not been cut, copy, paste everywhere. It still will be very modular.
Yeah.
But a lot of things that we've learned from the past will be used in the future growth also, basically.
And any plans for most of your growth is again going to come organically, or you think you would want to look for inorganic growth as well?
Yeah. So I think it has to be a mixture of it both, basically. Depends upon the size of opportunity also.
Correct.
And depends upon what is the value that we can add. We always think the growth, the way we think about it is what is the value that I'm bringing to the table.
Correct.
Rather than extracting value, my first thing is that how can I add value to that person?
Correct.
Whether I can develop a medical USP with him.
Yes.
If I'm going better at technology, can I take the efficiency processes by technology?
Yeah.
And third is, can I bring extra capital so I can scale the business up?
Correct.
So I think, and then obviously cultural alignment, integration, opportunity, it has to fit in with the ethos of the organization itself, basically, the blueprint of the organization. So there are a lot of factors that we have to consider before we, think about it, how it's going to be. We cannot change the model too much, but if the opportunity is...
cultural alignment is there within or not, and how do you integrate?
Yeah.
Fair enough. No, that's helpful, Dr. Shailesh. Last question again before we get closer to winding it up. Dr. Shailesh, is on how significant and what are the steps you're taking from an ESG point of view? So environment, social, governance, how important is it and what kind of steps you've taken?
So I think one of the things that Somerset brought, so we are NABH, we were the second hospital in Rajasthan to get NABH, and I think NABH is also evolved. So there is a lot of learning along with NABH. So NABH is on a digital mission, a lot of efficiency because of environmental. So a lot of safety point of view, NABH is very good at from a point of view.
Right.
From a governance point of view, medical governance point of view, it is good. But other parts of the governance, from the business point of view, governance, operations point of view, again, I think it sharpens your focus a little bit with ESG. Environmental part is becoming very, very strong. So, conscious use of electricity, water, how we treat the environment, waste, I think so, e-waste, paper waste, small things. One thing people always used to see this as an additional burden on us. But I think when you start understanding the processes and the intentionality behind it, because the impact is, you see the impact a few years later on. It's deferred. It's basically a longer term thing. But the day-to-day efficiency that it brings in the system, and when you measure that over the years, that is how I would say people who are going to go into the sustainability journey, the environmental impact has to be measured differently in the short term and the long term. it becomes very comfortable. The alignment with the team becomes better. And you have to look at from a different lens that it is not only your responsibility, but I think it can also define or differentiate your business.
Correct.
And bringing in a lot of efficiency also.
It increases your level of comfort also in the day-to-day operations as you scale up. So being a 50 crore to a 1,000 crore company, obviously you would need a lot more controls and governance and, as you rightly said, your responsibility towards society, all those needs need to be taken care of to differentiate yourself as well. So thank you so much, Dr. Shailesh. I think this has been a wonderful sort of insights for us, you being here. And again, I really appreciate you coming all the way from Jaipur to be part of this program. We would love to hear more from you. We would love to engage more with you in the coming years and see how we could, collaborate together on various initiatives that you have for your business. Any final comments you have for us or for the larger people who will be listening to this on the outlook of industry, and what is your level of confidence on the future growth of the industry?
Yeah. So I think, I think thank you, Vishal, and the team. I think it was, I kind of felt compelled not only for the reason that, here, but I think the kind of conversation that we've had in the past, and I think your outlook in the future for this industry, I think is very, very important to kind of, partner with people who have the similar vision. Definitely healthcare will grow. Not everything is consolidation. There are a lot of regional and micro market play.
Yeah.
Diagnostics is taken to a different sphere, is becoming more specialized. We're becoming more outcome driven in terms of genetics and personalized health. And the only thing I would say, as I said, if I was an end consumer of healthcare, there is a lot of talk about digital.
Yes.
Which is very important. But from a healthcare consumer to a normal consumer,
yeah,
how digital is being perceived by healthcare consumer is slightly different from how a digital is consumed by let's say an FMCG industry consumer.
Correct.
If we can have a playbook which is separate, because it has to be separate, the same playbook cannot be used for that.
Correct.
And we can evolve for healthcare people to understand how it has to be different, the digital part of it. I think that will be very, very beneficial for the consumer, healthcare consumer, especially in tier 2 and tier 3 cities.
So when you say digital, you're saying more digitization may be required in healthcare for internal processes to bring in efficiencies in delivery.
Yes.
And rather than, more from a customer experience point of view, especially in tier 2 cities, where the customer, your patients are more keen to get the right treatment.
Yes.
Rather than fancy hospitals or very high investment in technology. But tech has a role to play internally for the hospitals to make it more efficient and improve the quality of your earnings. Right?
Absolutely.
So again, I agree. Thank you. I think this is really insightful. I think most and quite relevant, because if you have to stay relevant, you have to stay agile. You have to make sure how can you relook at your cost drivers, and digitization will play a significant role in that space. So, thank you again, Dr. Shailesh.